Welcome to today's press briefing. We have with us two speakers. They are from the Center for Health Protection, Principal Medical and Health Officer of the Communicable Disease Branch, Dr. Albert Au, and Chief Manager of the Hospital Authority, Dr. Lau Ka-hin. We'll first hear from Dr. Au. Good afternoon, everyone. I'll report to you the cases we have received as of yesterday, the 19th of May, by the CHP. Yesterday, we had 113 PCR positive cases. 66 of them were confirmed by Hospital Authority, 2 confirmed by Public Health Laboratory Service, and 95 confirmed by private laboratory. We had 121 RAT positive cases. So we had 234 positive cases reported yesterday. So far, in the fifth wave, we have 1,196,109 positive cases, including 747,884 PCR positive cases and 448,225 RAT positive cases. Amongst the cases reported yesterday, 42 were imported cases. The remaining 191 are local cases. Of the 42 imported cases, 32 were picked up at the temporary sample collection center at the airport. 6 were picked up in the quarantine hotel during quarantine period, including 1 which is a 4th sample, 3 a 5th day sample, and 3 cases a 7th day sample. There are 10 cases from the US, 6 from the UK, and 3 from UAE, and 2 cases from Canada, 2 from Turkey, 2 from Japan, 2 from Korea, 2 from Singapore, and from Australia, Bangladesh, India, Switzerland, France, Qatar, and the Netherlands, and Switzerland. There are 1 cases each. For the remaining 34 cases, there is 1 case that is a 4th day sample, which is an RAT positive case. It's someone arriving from Canada on the 8th of May. That person stayed at the quarantine hotel till the 15th of May. The person went home and conducted an RAT test, which turned out to be positive. We will arrange for PCR test. There are also 2 cases involving a couple arriving from the US on the 3rd of May. They quarantined at the hotel till the 10th of May, and their samples from the quarantine period were negative. One of the couple showed symptom on the 12th, and the 10th day sample is positive. Family members show no symptom, and on the 14th May sample is positive. The last one is a 28-year-old female arriving on the 30th of April from Canada. She quarantined at the hotel till the 6th of May, and on the 12th day, the test was positive. CT value was high, and she was asymptomatic. In relation to genome sequencing analysis, yesterday, in relation to 86 samples, we've conducted such analysis. We have not found any positive result to L452R. All of them are negative to L452R. Yesterday, there was 1 case involving a previously infected care home. It involved 1 resident. The resident showed no symptom. Through an arrangement by the Social Welfare Department for residents of care homes to do PCR tests, the case was identified. At the end of February, there was 1 time when the test was positive using RAT. This time it's a PCR positive case with a CT value of about 29. Since some time has lapsed, it's possible that it's a repositive or a reinfection. Out of caution, we arrange for isolation for this resident. In the same room, there are 4 other people. They have to be quarantined. In relation to schools, we've received reports 35 cases involving 31 schools. That includes 29 students and 6 staff members. 30 of them are RAT positive cases and 5 PCR positive. There is also 1 pupil in kindergarten and 14 schools involving 13 students. There are 14 secondary schools with 14 students and 2 staff members. And in 2 schools, there are 2 schools, and there is also 1 special school involving 1 student and some staff members. Of the 35 cases, of the samples taken on the 13th, there are 3, 14th, 9, 15th, and also 13 cases. There are some reports received from schools that were tested positive over the weekend. They reported the positive results to the schools, which was then forwarded to us. There are some schools with more than 1 case, that is 2 cases. There is the secondary school and the primary schools. These cases have no epidemiological link. They were infected in the community separately. There is 1 special school involving 2 teaching staff. They work in the same office. They have meals in their office with their masks off. So these are linked. We've arranged for other staff members in the same office to stay at home for quarantine. Of death cases, so far we have 9,148 death cases. Yesterday, there was no additional death cases. The current death rate is 0.76%. Those above the age of 80, the death rate is 10.45. Let me give you some information about updates of clusters. The first one is Imperial Kitchen. We have 2 extra cases, 1 male, 1 female. So far, from this cluster, there are 11 cases. They're all customers. So far, no staff members. There are 8 patients with 3 doses and 2 cases with 2 doses. They are aged between 28 to 69, and there are 4 PCR tests positive. 3 of them asymptomatic. For the others, between the 11th and the 13th of May, they show symptom. Yesterday, we went to this place for a visit. We have obtained 22 environmental samples. They're all negative. In relation to Imperial Kitchen, a compulsory testing notice was issued. Those who've been there between on the 9th between 5 p.m. and midnight, they have to be PCR tested today and tomorrow. In relation to Sky Cuisine, there are 4 new cases, all involving the evening on the 7th of May. There are 3 picked up by CTN and RAT, 1 PCR test, 3 female, 1 male, involving 3 families, 1 asymptomatic, and there are also some other dates. In relation so far for this cluster, there are 56 cases involving 56 customers and 1 staff members. There are 3 environmental samples that turn out to be positive. So far, there are 5 such samples that are positive. There were 2 that is obtained from female toilet and a male toilet. For the 3 new positive samples, they are on the 3rd floor, a cabinet with crockery, and 1 is from a ventilation vent, and also 1 also on the 3rd floor, which is a button of the dish lift.
And lastly, the Sanmon Club cluster. There's one additional case today involving a person who went to the place on the 9th of May, and the symptoms onset was on the 13th, and he was tested positive in PCR, and he is 63 years of age, and there are 13 male and 1 female. And their systems onset was from the 9th to the 13th of May. And there is a Belia table which was proven positive with environmental sample, and there had been disinfection work carried out, and we took 4 more environmental sample, and they were all negative. This ends my report. The HA, please. Greetings. There are 712 confirmed cases who are at the North Lantau Infectious Disease Center and the HA Infectious Disease Center. 1 additional case is in critical condition, and there are 2 other critical conditions in the ICUs. Yesterday, there are no new deaths reported, and 50 patients had recovered, including 25 who have been discharged from hospital. From the onset of COVID-19 till now, there have been 49,377 cases recovered, of which 48,897 have been discharged from hospital. And since the 2020, there had been 61,757 cases already recovered, and discharged from hospital was 61,277. And in hospital screening, positive cases had resulted in close contact designation for the patients in the same ward. And for staff, 22,894 have been confirmed cases, and 22,742 have recovered and returned to their posts. The lady over there, cable TV. I have a question concerning the couple returning from the U.S. What is their CT value? And on returning to Hong Kong and the community, where have they been to, please? A second question concerning the private kitchen case. The 2 new additional cases today, how many were actually sitting down to eat at the time without masks? And it was mentioned that some of them just picked up food and left. So can it be that the source of the infection was not at the kitchen? And also for the Sky Cuisine and this private kitchen, had the genetic sequencing been completed yet? Are they linked to each other? And also by the end of the month, citizens of Hong Kong will have to complete the 3 jabs before they can go into certain places and venues. And today, there's a Hong Kong U professor said that this constitutes to compulsory vaccination. But actually, citizens of Hong Kong have the right to refuse vaccination. And for those who are 60 years or under, the proposal is that they can be exempted from the vaccination pass. Well, for the couple concerned, on the 3rd of May, they arrived in Hong Kong and they stayed in the quarantine hotel, and the test had been negative. On the 10th, they left the hotel, and preliminarily, we find that on the same floor, there were no other confirmed cases during the time that they were there. And for one of the persons, on the 10th of May, after he's left the hotel, he or she had been to the community to do shopping, etc. And on the 13th, there had been 12th, there had been symptoms, and on the 14th, it was proven to be positive, and the CT value is 15 to 16, relatively low. And we expect that this can be a locally infected case. So we will do a complete genetic sequencing to see whether it is an imported case or a local case. And as for the family members, they were traveling together. They're asymptomatic. And on the 14th of May, it was a positive case, and the CT value was 34, relatively high. As for the cluster of the Imperial Kitchen, there are 11 cases we have found so far. And we have asked them, some of them told us that they were there to pick up certain takeout food, and they stayed for just a short time. So we will have to investigate further. For the 2 new cases today, we have asked them, and they said that on the day they went to this private kitchen or Imperial Kitchen because of business meetings, and they have stayed for over 2 hours at the venue. And we are looking at the CCTV footage to see on the day what is the duration of stay for each of the cases concerned, and to continue with the investigation. It is possible that certain persons entering the place did not put on their mask, and therefore there had been infections. The investigation is ongoing as far as we can see for now. These cases were not affected during their movements in the place, because apart from the 9th of May, with that particular meeting, we traced their movements. The other movements of theirs did not involve any gatherings or any commonalities. The third question you asked was about the Sai Yun Toi and its relationship with the Sky Cuisine, the West Terrace and Sky Cuisine. We took environmental samples and we did the genetic sequencing. I believe within 2 days there will be results, but not now yet. As for the vaccination pass, as you all know, at present, whether locally or overseas, scientific evidence shows that the 2 vaccines in Hong Kong, used in Hong Kong, are safe and effective, and they can help avoid deaths or serious cases, so that once infected, it would lower the possibility of serious symptoms or hospitalization. So vaccination is a very effective means of avoiding serious cases or hospitalization. As for the 3rd dose vaccination rate, it is not satisfactory in Hong Kong as of now. It is but about 50% or less. And according to the joint scientific panel, it is recommended that 3 doses should be taken for each individual for vaccines. And once there is normal activities in the community, when that resumes, we will have to rely on the vaccination pass, especially where there are high-risk occasions or certain gatherings where the persons involved have received the 3 jabs. It is really an effective protection for them in engaging in these activities. So if there are certain reasons, for example, medical reasons, where the persons concerned should not be taking vaccinations, they can consult the medical doctors. If the doctor also concurs, then there can be an exemption certificate given to these individuals. The next person, this gentleman over here, in 730. Concerning Imperial Kitchen, apart from takeouts, do they provide on-site eating? How many people are involved? How many people have been there? Do they have to scan, leave home safe, or provide vaccination pass? How many visitors are involved, or what percentage of visitors are involved for those who had visited the Imperial Kitchen on the day? As for the billiard room, is it linked to or related to any overseas strains? Now, also, there is another case which had been screened by the Social Welfare Department for the nursing home person. It is said that it is possible that this is a reinfection case. So are there other cases in the same nursing home? What about the other staff and inmates? And in the fifth wave, how many reinfections have there been? That is, repeated infection by Omicron. And also, the Hong Kong U professor, he said that for 60 years of age, it should be a cutting point as a risk watershed. What is the difference of risk profiles above or below 60 years of age, please?
In relation to your first question, that is Imperial Kitchen, we are currently carrying out investigations. We learned from these cases that they went there not to eat, but just to pick up their takeaway food or to attend a business meeting. Some of them might have taken off their masks, but they all deny that they went there to eat. We have contacted the person in charge and we were checking the CCTV. We found that there are about 40 people who have visited that place. We've also visited the site. There are several tables at the premises and there is also a kitchen. There is a room for karaoke or mahjong. We have obtained environmental samples. So far, they are all negative. It's covered by the Leave Home Safe app, and the patients have all used the app. It's through that we found the cluster, but it's not covered by a vaccine pass. We try to obtain information about those who have been to this place. We have obtained a partial list. We have sent them SMS asking them to do a compulsory test. In relation to the snooker room, that is, one case tested positive on the 11th, the other on the 12th day. The samples have been sent to the public health laboratory service for genome sequencing. We'll see if these two people are infected locally after the quarantine period. In relation to the care home for the elderly, previous week the SWT issued a press release saying that in the coming few weeks they will, for all care homes for the elderly, carry out PCR tests for those who have not done so. They have already finished the first stage. There are about 2,500 elderly people who have been tested. We've identified 41 repositive cases. There were no infection record in the fifth wave, and their CT values were all very high. After the first positive result, the second test result were either positive or uncertain with a high CT value. So we believe that they have been infected but were not picked up. So this time they have tested positive. They are repositive cases that are not contagious. The second stage was rolled out last Friday, which will cover about 7,000 or 8,000 elderly people. We are still collecting samples. So far, we have found 13 positive cases, of which 12 we're quite sure are positive cases with a high CT value. But there is one case with a CT value lower than 30. Out of caution, our current approach is to treat it as a new case. But it doesn't mean that it is definitely a reinfected case. It may be a repositive case because we've seen repositive cases with CT value lower than 30. We'll see what other residents in the same room are like, because so far there are no other residents or staff members that have been tested positive. We have not identified any reinfection by Omicron. We have found some reinfection cases, but the first infection was before Omicron. They have been infected, but not by Omicron, but then later affected infected by Omicron. In relation to vaccine pass, well, for vaccination is very effective for people of all age group. But for those that are above the age of 60, the risk of serious case and fatality is higher, so they need that extra protection. However, regardless of your age, there is also a risk of there's always a risk of a serious condition if you are not vaccinated. So, if possible, if you are vaccinated, covered by 3 doses is the best way to protect yourself. The gentleman, I'm from Mingpao. First, I want to ask about the overall situation. On a number of occasions, the authorities talk about the effective reproductive rate. Today, the rate is 0.96, which is close to 1. According to your assessment, what is the trend of the current epidemic? How much do we need to tighten the social distancing measures for that effective productive rate to reach 1? And in relation to Hong Kong U scholar about exemption from vaccine pass, have we have antibody or immunity barrier? When will we reach that immunity barrier? Any chance that we can see exemption from vaccine passes? There are a number of experts who have given different views. So what do you think about these diverse views? In relation to schools, you mentioned about 2 staff members from a special school. They had a meal in the same room, and the colleagues are classified as close contacts. So for this school, so far there are only 2 cases. How many people have to be quarantined at home? Any students? That is, how many students and staff and teaching staff amongst those who have to be quarantined at home? In relation to Imperial Kitchen in Kwun Tong, well, according to Dr. Ao, the people went there to get takeaway, but you don't rule the possibility that they've taken their masks off. So what is the actual situation? And you talk about a room for karaoke or mahjong. So what's the business nature of that place? Apart from business meeting or people going there to get takeaway, did people engage in any other activities? Is that all? Well, my last question. Please be precise and concise. In relation to Sky Cuisine, what's the accumulated number of patients? So far, how many cases? Thank you for the question. Your first question is in relation to the development of the epidemic situation. In the past 2 weeks, daily confirmed cases are about 200 to 300. There are changes of above 50 cases on a day-to-day basis. We have not seen any trend of further reduction. It looks like that we hover at around 200 to 300 cases a day with no sign of dropping. In the past 7 days, the average daily case is 275. The previous 7 days, the average figure is 289, and the previous 7 days is 357. It seems that in the past 2 weeks, it's about 200 and 300 cases. At the same time, we have not identified any increasing signs or any signs of a rebound. Apart from the daily infection cases, we have not identified any clear signs from other indicators. It is a high level, that is 200 to 300. Compared to previous outbreaks, it's double the number of cases at their peak. It shows that currently in the community there are numerous transmission chains. According to our epidemiological investigations, we've identified some clusters, especially sizable ones. It shows that in the community there are transmission risks or infection risks. At this stage, when people go out or get on with their daily activities, they should exercise vigilance in relation to the anti-infection measures and exercise good personal hygiene. There are relaxed social distancing measures, but please don't let your guard down. Get vaccinated, and if you have symptoms, get tested and stay at home.
As for HKU's effective reproductive rate, it is now close to 1, and this is within expectations because this effective reproductive rate, its meaning is actually one case will be able to transmit the disease to how many cases. It's a measurement of that. And if we keep it at a stable number of cases, then it is possible that 1 is passing it to 1, and therefore the rate is about 1. Where it is above 1, then that is an upward increase. That means that there can be possible outbreaks. Especially if people let their guards down, it can happen. So we will closely monitor the situation and also the rate. And another question concerning immunity barrier. The so-called immunity barrier is about how many people within the population already has the immunity, and that can be from vaccination or from previous infections. Now, the higher it is, the lower the possibility of outbreaks. But at the same time, we have to pay attention to this barrier. It can only be temporary because for those who have been previously infected in the early stages when they have recovered, the immunity would be high, and after that it would lower, and there can be reinfection, especially for those who have not completed their vaccination. Their immunity would not be complete. A third question about the special school cluster. Preliminarily, according to the school submitted information, we find that there are 2 staff members involved in this school, and we have conducted immediate investigation to see whether they have any epidemiological connections. And we find that they're working in the same office, they are clerks, and they do not come into contact with students, not in their everyday work. And the last day of reporting to work on this was the 13th of May, and it was a negative result. And during the holidays, they have been confirmed positive. So it is possible that they have passed the disease on to each other because of the epidemiological link. And there are 5 officers in the office who are working in the same office, and they may be taking off their masks to take lunch, etc. And so they have been quarantined. As for students and teachers, the rapid tests this morning have proven negative for all of them. And another question was the Imperial Kitchen outbreak. According to our preliminary findings, investigating the person in charge and the persons related, on the day in question, people were not eating there. But on the other hand, we did see kitchens and dining tables at the venue. So we want to find out what the purpose was for them in going up to the venue and whether they had indeed taken off their masks. I call on all persons who have been to this venue on the 9th of May in the evening. All these persons, please comply with the testing order to do as soon as possible a PCR test. As for the Sky Cuisine number of people, in total 56 cases are involved, including 50 customers and 6 staff members. If there are no further questions, we will close the meeting here. Thank you.